Welcome to the Shape the World podcast. I'm your host, Joel Palau, and joining us today is Dr. Mark Grunwald, Medical Director at the Carilion Clinic's Institute for Leadership Effectiveness and the creator of the Peer RX Med program. Dr. Grunwald is a seasoned expert in healthcare leadership with an in-depth understanding of workplace dynamics that contribute to physician burnout and proven experience implementing effective systems-level strategies to improve physician well-being. Together, we'll be discussing how healthcare organizations can truly create a better future for providers and patients alike by embracing wellness into their overall strategic aim. Dr. Grunwald, thank you so much for joining, and it's a pleasure to have you here.
It's a pleasure to be here. I really appreciate the opportunity to chat with you once again. I've enjoyed all of our conversations over the last few years.
Appreciate having you as a thought partner and someone I can look to for advice and support, especially with such a challenging topic as physician burnout and how to address it inside of a large-scale healthcare system. I wanted to kind of touch on taking it back to the beginning. What initially inspired you to pursue a career in medicine and become a physician?
I grew up in a medical family. My father is the retired family physician, practiced for 40 years. My mother is an RN, and she was involved with many, many different things in her role. I have some extended relatives who were also in medicine. My mother's mother was a very devoted nurse. And so I grew up around that. And so I think for me, seeing my father who loved what he did, I got to see he had a private practice with 3 other partners. Got to just watch that whole process in action. I used to round with him when I was a younger boy. He still did hospital rounds, and I can remember rounding with him and seeing all the other colleagues and just that whole area. So seeing somebody who is satisfied with their work, I think for any of us, regardless of what our role models, parents and role models do, if we see them happy, that's going to grab it. That's going to attract us in the first place. But then I've always been interested in the sciences, in the social sciences, in certainly thinking about the combination of what medicine brings. And so I think it was really a natural match for me. And that really probably since I was a young boy wanted to be a physician. So, except for being an astronaut at one point in time, and I think I went through a phase of wanting to be not just a physician, but a neurosurgeon. So I'm not sure what television show was on at that point in my life, but yeah, it just seemed always natural to me. And that's the case as I got into medicine. I just loved what I was doing.
I have a lot of respect for physicians just because of what they do on a daily basis, the impact they make to people's lives, but also what it takes to be a physician. Between med school itself, residency, and then the day in the life when you're in practice. Were there those moments along the way when you maybe almost questioned the decision to become a physician?
Oh, yes. I questioned it when I was in college, and I actually did some additional work to try to help understand a little bit more what was it that I was being drawn to with medicine, and to make sure it wasn't just my father. And then when I was in residency, I also, my chair during residency, actually this was during medical school, my chair, the chair of family medicine at the time, Louis Barnett, suggested when I was a 4th year medical student, still trying to decide what I wanted to do, he suggested that I go and do rotation with my father. I live in Ohio, interestingly, so I did, and it was wonderful. And what I realized is that I definitely wanted to go into family medicine at that point in time, and I could be different than him, that I wasn't just going to be following in his footsteps. And my career has taken a completely different trajectory than his did. But I can remember growing up, even hearing people say you're going to grow up and be, quote, just like your father. It was not an insult, but it was one of those, everybody wants their own identity. And I think that was something that I certainly pushed against. And so that was a real gift to have the chance to work with him. During residency, certainly I had moments. Residency is very, very hard. And had moments when I thought, do I want to do any of this? It wasn't even just about being a family physician. It was about being a physician in general. And so lots of good pep talks, lots of wonderful mentors along the way who really helped provide encouragement, helped to provide support. This was the guy I trained at the time when we were talking about a lot of things we're talking about now in terms of burnout and mental health and things like that. But I had an incredibly supportive residency family, for lack of a better word. We really were a family, and we were in it together. And it was never a time. There was never a time when I certainly questioned at all the support that I was getting, which was a gift. I mean, I think that that's something that many who are training now wish they had more of, and that was not the case for us because we were supportive of each other.
Great point. Like having that network of peers that you can lean on in the hard times can make it, doesn't make the challenge go away, but it makes it so much easier to handle the obstacles in front of us.
Sure, it makes it possible. That's why, people who go through things like SEAL training, the ones who get through are not the ones who are the best individuals. It's the ones who can work best on a team, which is exactly what the military is looking for. And it's that idea of a team can help you see possible in ways that you may not on your own. And when we get discouraged to not have somebody speaking into that and giving us heart, lifting us up, I think is impactful. And I worry that that's often the case now. As you mentioned that I started the PRX Med program, and it was for that very reason that what I don't sense in healthcare today is the same sense of camaraderie that we had at one point in time, that we really were connected to our work. And I'm not sure, I wouldn't say it's a good or bad thing, but it is different, and I think it has an impact. We really lived, I'll use the example when I was a resident, we lived with that group. We socialized with them, and that was our group, but that was also our support system, and they knew what we were going through. And I worry often that residents today, they obviously have lives beyond medicine, but I worry often that they don't connect enough in many ways with that role that they have, that it has become a little bit more transactional, 80-hour work weeks and things which are fine, and they provide barriers that needed to exist. And yet it all makes it seem like more of a job than a calling in some ways.
Research is showing that right now, roughly 6 out of 10 physicians are experiencing some degree of work-related burnout.
Yeah.
So historically have one of the highest rates of suicide out of any profession. Experiences. I've even noticed sometimes residents come out of school ready to start joining the workforce, and they're already showing symptoms of burnout in how they're feeling physically and mentally, and then also in the way that they're approaching medicine moving forward. Maybe they're not as willing to, like you said, right, to dive into it as their ultimate calling, where they're really trying to create those barriers early on to protect themselves. How important is it that self-care practices and establishing that strong support network happens early on in a physician's career?
Yeah, I think it's vital, Joel, because it becomes a habit. And once you're connected to that, you realize what that can bring for you. Yeah, the opposite is also true. It becomes a habit to not do it. And often what I worry about is that the more we go through training not having done that, the harder it is to do it. So unless we socialize that and normalize that, as that's just what physicians do, we are there to support each other. What I see often by the time you get out into practice, when it's busier often than in residency, it's different. The hours are different, but in terms of the intensity, often it's busier. I see a lot of physicians even working in the same practice, often operating more as parallel private corporations. And they can often go a week or more without even seeing each other, let alone connecting with each other. And so the ability to make that a priority, and then to figure out how do you actually do that. The busyness is still there, but how do you make sure that you just don't have tunnel vision and miss the fact that that connection is a recharge? That should be part of your day and part of your week and part of your just professional rhythm, to make sure that you don't all of a sudden find yourself out there feeling burned out. And what we know about burnout is that as people start to get to that place of burnout, often what they do is withdraw. So rather than reaching out for help, they withdraw. And what I saw it happen too many times. And the tragedy of that is that if you have somebody who knows you well and you're checking in with regularly, you're going to both likely see that you're starting to spiral downward, but also you'll have established that relationship such that they'll be able to say to you, hey, what's going on here? Like, you're not being yourself right now, and let's talk about that. And you will feel safe talking with them about that. Just to use an example, so I think about a program, a peer support program such as PeerX as being preventive. I'm a primary care physician. That's what I think about. Whereas as you see a lot of programs that are happening within healthcare right now, particularly within hospital systems, they're peer coaching or peer support programs. But in those programs, look, I think they're important for what they do, but they're just the tip of the iceberg because what they do is you have to have something happen. Like you have to have symptoms, if you will, before they will then intervene or even think about intervening. And they're a variable stranger. So they don't know you. So you're already starting out feeling quite vulnerable with a peer who you don't know, which I think is not a setup for ultimate success. And so that's why I really believe it's important for everybody to have that support. And it's got to be with somebody who gets you. Like, my wife is a physician, for instance, but I realized early on in our relationship that I couldn't keep coming home and bringing all the heaviness to her. Like she could feel it, but that's not the vision I had for our relationship. And so what I realized is I needed to have somebody else who I could process some of the things that happened so that I could go home and not bring that. I could bring a better version of myself home for that relationship. And so there's lots of compelling reasons why having somebody in your world who can provide mutual support becomes really important.
I think that's a great point. I think someone who's lived the experience can understand a lot better what a person's going through. I've seen it. I've seen physicians who connect with other physicians already have that sense of camaraderie because they're facing similar challenges. And what's great is that if somebody's overcome that hurdle in the past, they're able to talk to their experience, and then maybe it's become something that you can take away and apply to your own. So I think that's very important. And then you also hit on the concept of this relationship being something that was established way prior to burnout, so that it's a friendship that builds over time, and it's not that we're meeting for the first time when one person's in a crisis state, and it's a lot difficult then to make that connection.
Yeah, and it's interesting, Joel, that often we talk about being collegial within healthcare, and I think that's a wonderful concept. But often collegial implies, at least it did when I was training, and I think it still does. I'm very much involved with medical education still, and collegial is often very professional. So it focuses on the interaction at the level of the patient, and doesn't often get into the level of the personal. And so even though I think that collegiality is important, I don't think it's enough. I think developing professional friendships, which is really what we're talking about, is vital, especially I think in the world that we're living in now. I think even more so than it perhaps was before, because there was a lot more opportunities for interconnection. I think back when most physicians were still rounding at the hospital, and there really was a central place where they gathered, where medical societies were more active. All those places where folks could come together and socialize and in many ways support each other. And we just don't have that now.
One of the experiences I remember most fondly was actually bringing a group of physicians together who all worked in the same state but had never met each other under the same brand. And just giving them that time, that half day to meet each other completely outside of the office, nothing work related. It didn't change the circumstances that they're facing, but it really created an environment where they could meet each other and have new people to rely on whenever they're feeling overwhelmed. And also it became a way to unify them around some of the changes that they want to impact in the workplace. So how important is it that organizations get very intentional about creating time for physicians to connect with one another as part of the work that they do?
Now, I think that, Joel, that's part of a more comprehensive strategy that organizations would do well to think about as they think about how to help physicians who are struggling, whether it be with burnout, whether it be distress, discouragement, all those different things that can happen for physicians, and thinking, okay, what is our strategy to support them beyond just kind of individual interventions? A lot of organizations, as you know, tend to gravitate toward individual interventions. How can we help support you better, whether that be through mental health services, whether that be through peer coaching, whether that be through teaching you about, relaxation, mindfulness, all those things, all wonderful things, all things I believe greatly in. And an organization's main job is to do the things that only they can do. So thinking about, how can they create the environment in which physicians can easily practice their best medicine? And so that doesn't have as much to do with helping to support my mental health, though I think that's important. But it's creating circumstances such that my mental health isn't as stressed as it is because of that. So it means things like, how do you create a very efficient electronic health record? And how do you support physicians to make sure that they know how to use that tool as optimally as possible? How do you make sure that staffing is appropriate and the staff is well trained? How do you make sure that physicians are well oriented into the organization? I wrote an article with two colleagues about how to be employed well. And the whole idea was to say that the majority of physicians will be employed for the near and likely far future. And so one of the things I was never taught was how to be organizational and successful. So how do you literally be part of a large organization, and be part of it, not just say, I'm over here, give me my office and pay me a salary and give me a staff and leave me alone, which I think is what many physicians fantasize about when they think about being employed. And that's not part of being part of a large organization. So how can you do that effectively? And part of that is helping the organization see what you need and then stepping up into leadership so you can help impact that, rather than just saying, organizational administrative leader, go do this. I'm going to work with you to help you do this for the sake of my colleagues and for the sake of my care team. So it's all those things. But I think the first step, Joel, is making it a priority and then involving physicians in that conversation as well. That's the other thing I see a lot of organizations is they say it's a priority, but they don't have any kind of infrastructure to actually get physician input and then an infrastructure to actually do something with that. So it's not enough just to give it a lot of words. You have to actually follow through and be able to do things with it.
I love that approach, and I think you're right. It's very important to support individual providers on their personalized self-care strategies and create that atmosphere where they can do that. But ultimately, it comes down to taking ownership for what can be done on a systems level, because oftentimes the onus of wellness falls on the sole provider. But they're really, you could have the best self-care. There's like that example of the canary in the coal mine. You can have the most, and I've seen it, the most resilient physician. They're mentally in a good place. They go for a run every morning. They eat healthy meals. They have, a good relationship at home. But you put them in a circumstance, an environment where they're not able to get their work done. They don't have the support they need to deliver proper patient care, and they're, using software that's not helping them complete their tasks in a timely manner. And that ultimately starts to create this cascading effect where no amount of self-care practices can overcome the situational conditions that a provider might face. And that's that disconnect.
They're constantly breaking down, and I can see how quickly that can happen for a physician when they're not given the tools that they need to be able to do what they're being asked to do. And we both know the data around the electronic health record and how challenging that has been in terms of contributing to physician distress, physician burnout, and things like that. And sadly, even after we've named that for a long time, I would contend that we've still not been able to really impact the changes that need to happen in order to really, in many ways, neutralize that and make it just the tool that it is, rather than dominating a physician's well-being on a daily basis. And that to me has been a huge concern for my own organization and for lots of other organizations who I work with.
I think to that vein, another important idea is this thought of normalizing burnout. Whereas, and I've always been of the view that this can happen to anyone. It just depends on circumstance, right? Whether personal things going on in your life or professional. If those things persist, no matter how resilient you are as an individual, you can be burned out. It's almost becomes a matter of when.
Yes.
And that's where I think a company may make the mistake of looking at a certain percentage of their workforce as being highly burned out, as opposed to looking at it like this can happen to anyone in our workforce. And it's not so individual, but rather there's these broader contributing drivers that affect it.
Absolutely. And, Joel, you talk about normalizing it. If you think about the data, which I think we've just become hardened to in many respects, if you think about what physicians do every day and think 50% of them are operating at a very suboptimal level. I mean, just by definition, somebody in burnout is not operating with all of their capacities optimized, and they're doing surgery. They're taking care of patients in the hospital, writing prescriptions for things that could help or harm them. And it should distress greatly any healthcare administrator because that's their team. That's their product. And you can't provide world-class care if half of your workforce is at a place where they can't even hardly get through the day. So even saying we have a third of our physicians who are burned out, or 20%, should still raise the alarms and say, what do we need to do to make this not happen? You can imagine, as often as compared, airline pilots, if hinted studies that show 50% of airline pilots were burned out, there would be congressional hearings about that. There would be demands for action. Whereas often I think we hear about physicians, and I hear even sometimes administrators say, yeah, I can see that. It's pretty hard to be a physician. So I can see how they could get burned out. And that to me shows a lack of appreciation of what we're really talking about when we're talking about burnout. And
I
these are
agree, and
people,
I've even seen it to the point where this physician's burned out. They must not be a good fit for our model of care.
right? Yeah, they can't take it. They can't handle it. And again, you think about people who've gone through training that is amazing. The flip side of that, Joel, that I've learned about. So I was an early adopter of the sense of fix the system. Quit talking about quit blaming physicians for not being strong enough. Fix the system that's so broken that anybody would break down over time. As you point out, it's just a matter of threshold. It's not a matter of if, but it's not a matter of if, but when. And so what I've come to appreciate about that, though, and I think based on your background, I think you appreciate this as well, is that even though often when we talk about being more resilient, it feels like we're blaming you for being weak. The fact is that resilience is not a static quality. We just talked about that. And we know that there are things you can do that will elevate your resilience. And so why would we not, as highly trained professionals who really need to be on our game all the time, want to, just like a highly seasoned professional athlete, continually look for ways to recover, look for ways to optimize our ability to perform at our highest level. And that is about elevating our resilience. So those are doing the things that you just talked about in terms of making sure that we're well fueled in terms of what we eat, that we do get good sleep, that we have vacation, that we do all those things so that we can show up as our best selves. So I do think, and I think there are things we know we can continue to do to help that. So to me, it's that both and. Systems have to own system stuff because I can't. And then systems, I think, have a responsibility to support me to continue to elevate my ability to be the best I can be, whether we want to call that resilience or thriving or whatever those flourishing, any of those things. That's what an organization should want from me as an employee. Like I want him to be on his best game as he goes in and sees those patients today because he's representing our brand. He's representing our team.
I love that concept of resiliency, and oftentimes I see that it's easy to see what can make someone resilient on the individual level, but companies sometimes struggle to bridge that gap in terms of what can make them more resilient in an organizational level. So speaking to their communication strategy, their work design, their leadership development practices, and that's where they miss the mark, where resiliency efforts are focused on, like, to your point, the individual and not the system itself.
Sure, and there's great studies that show the impact of just different approaches to leadership on physician well-being and burnout. And not surprisingly, certain leadership styles can elevate physician performance, and certain leadership styles can undermine physician performance. And so you're absolutely right that there are system things we know that can be done that will globally help elevate that threshold for burnout. And often I don't think systems understand that, at least based on what I both observe and hear about in terms of leadership. And you think, wow, where did they get the idea that that could happen? and somehow physicians or others will respond in a positive way to that. Like that will just drag them down. And so there's a science to this. We know that, and yet we fight against it often despite that.
And digging into the research, it seems like healthcare in general is facing a workforce shortage challenge into the future. As we head into 2030, there will be, at least projected to be a lack of available physicians, a lack of nurses. And it makes me think the only thing worse than having a large number of burned out physicians helping patients is having a very small number of extremely burned out physicians helping a lot of patients. How important is it as we look into the future that we get the physician experience right in healthcare if we want to keep people interested in becoming doctors, and if we want to try to maintain some of the doctors who are on their way out a few more years in the profession?
Oh, it's essential. We certainly know. In my own organization, we've implemented some programs to begin to intervene at the personal level, the individual level, to actually have those conversations with physicians and to talk about, what are your satisfiers, what are your dissatisfiers, what, for those who are nearing retirement, what would it look like for you to feel you needed to quit today? What would it look like for you to say, you know what? Maybe I'll stay on a few more years, even part-time. Because certainly in my own region, which is not over-doctored by any means, we lose a primary care physician. That's huge. Those are patients that don't necessarily have anywhere to go immediately, and so they're floating around out there. So it really is essential. The healthcare workforce projection numbers can be mind-numbing in terms of really understanding, okay, do we really have a physician shortage, or just a shortage in certain areas, or is it just geographical, or is it just by specialty? And so I don't get caught up as much in that, partly because I don't have a lot of impact or influence over that, but really thinking, how can I make sure individual physicians are brought up in a way that they love what they do, and that we create circumstances where they can do it well, and I think are appropriately rewarded for doing that. And the more I think we do that, and then the more we keep them connected and growing and feeling like they are being challenged in appropriate ways, I think all those things will help them decide to stay within healthcare longer than they would. And the fear, Joel, is that you lose often your best and brightest. The first people to hype are the people who have lots of options outside of healthcare, and that's tragedy. So we can't afford to lose people. We want to be bringing more in, and so you're right. And part of that is physicians taking, or organizations helping to take care of those who are part of their team. I don't know if you're familiar, Joel, with the AMA's Joy in Medicine.
Yes.
The health system recognition program. I've done some work with them around that, and to me, that's a demonstration of what an organization can do, because what I love about that recognition process versus some others that are out there is you actually have to be able to show you're doing something, not just say that it's important to you. A lot of things you can sign up and say, yes, we believe in well-being and the fourth aim and all those things, but you don't have to demonstrate that you've done anything other than signed up and put your name out there. Whereas this really calls systems to say, but if it's important to you, how are you actually demonstrating that? And the goal is to be able to start to differentiate those systems that really do appear to want to help support their workforce beyond just words, and those that don't. And it could become a marketplace differentiator in terms of physicians looking for where they want to work.
Oh, 100%. I mean, I think the Joy in Medicine framework really bridges that gap between understanding physicians' needs and their drivers of burnout to connecting that to executive level commitment to make those systems level changes, especially in the categories of leadership, practice efficiency, and support. Those are some of the main areas where physicians really need that extra assistance.
Yeah. And then even, because one of the areas is surveying. And, the ability you can, and even my own colleagues sometimes roll their eyes around surveying. And what I hear them saying when they do that is not, I don't want to take 5 minutes to fill out a survey that may help to advance my well-being. What I hear them saying is, we've been surveyed before and nothing happened.
Exactly.
So don't ask if you're not really going to do anything about it. But the idea of saying we're surveying, and then we have to actually demonstrate that we have We have looked at that survey, we have processed that information, and then we have done something about it, and we've resurveyed to see whether it made a difference or not. That to me is a very different conversation, and one that excites me.
Another incredible benefit too is the benchmarking to other organizations, and also the establishment over time of best practices in each category that I think will elevate healthcare as a whole.
Absolutely. No, absolutely. I think it's a really good model for what can happen. And I think as you point out, that it provides something outside of an organization as a benchmark to be able to say, not just we think we're great, therefore we must be, but you know what? We are not as good as we think we are. How do we know that? Because here's some things we're just not doing that we know will help advance our care team well-being.
Yeah, and when we talk about, doctors leaving the profession of medicine, it's a sad thing to see because there's so much that goes into becoming a physician, and so many lives impacted by a great doctor. And one of the things I've noticed is sometimes organizations are shocked that they're losing their best physicians. And what they may not realize is that sometimes the best, hardest working physicians are actually the most burned out because they haven't given up, and they're working under a system that isn't supporting them to its full capacity, and they're giving their all. So, I would always caution organizations to not just look at people who are chronically burned out, but who's on their way. Because, it's easy to fly under the radar when you're putting, when you're saying everything's fine, but we have to look a little deeper and see, is it fine, or is it only fine for now until that physician eventually reaches their limit?
Well, and I smile whenever I hear the word fine. Fine is a disguise for many people, and most people, most physicians, if you just think about it statistically, if more than half of physicians are in this place called burnout, most of them can't be flourishing. The other half are just not flourishing. It's not a dual U-shaped curve. And so most of them are in survival mode. And, you could think about survival mode at any point in time as being pre-burnout. Because in survival mode, it's not going to take much to put you over that threshold. And all of a sudden you're burned out. And so you're exactly right, Joel. What we do know is that physicians will not show often their symptoms of burnout just because they've been so socialized professionally that you just don't do that. So when you start seeing physicians who are demonstrating their distress, like they're way down in the burnout land at that point in time. And so, that should become a 911 in terms of saying, well, we've got to intervene and do something to help this physician and to figure out how did we create the circumstances that allowed them to get to that point. Like that shouldn't happen. And yet it did. And so what do we need to do to change that as well? And I think we often address the first part. We rush into hell, but we don't address the second part, which is how did that happen in the first place? And it's not an exception, it's the rule. So what are we doing, and what do we need to be doing different?
Organizations definitely want to transition from having the bulk of efforts be retroactive to proactive.
Well, that's the new.
And the more upstream they begin that journey, the better off everyone's going to be.
That's hard, Joel. The organizations, particularly now, because organizations are in survival mode as well. And I worry we don't measure this, but how many organizations right now in healthcare are actually burned out? They're experiencing organizational, not just individual burnout, because it happens. As you just talked about, anybody can get to this place of burnout. So we talk a lot about physicians. Certainly nurses, we know there's data around that. But what we don't talk a lot about is healthcare administrators.
Yes.
And only healthcare administrators are burned out as well. And they're making huge decisions that are going to be impacting positively or negatively often burnout physicians. And so it's the perfect storm for us to not be able to dig out and to be constantly in reactive mode rather than proactive mode.
And I've historically seen burnout as a lagging indicator, where, like, to your point, by the time it's really mentioned and someone's really being willing to be open about it, they're pretty far down on their journey towards getting chronically burned out. And with your point about leadership, it's interesting to see in organizations what variance can exist in certain geographies because of the leaders that are occupying that geography. How you can have pockets of workplace culture within a broader culture. And it's really the leader that protects their team from a lot of what's going on in their communication, action, and willingness to support. But leaders, of course, have to be in a good place to do that.
Oh, it's so important, so absolutely important. At least, yeah, even within our own organization, you have practices spread out over a large geographical region, and there are microcultures that are thriving even in the midst of struggle that may be happening at the organizational level, and practices that are not. And a lot of that has to do with local leadership and local culture.
Another big change coming down the pipeline in healthcare is new organizations joining the healthcare space that weren't previously part of healthcare. I think of companies like Amazon, who are known for speed and volume, and automation that might be disrupting the way care is delivered. In addition, so much artificial intelligence in general poised to change how we communicate as human beings. How important is it that as companies begin to embrace these changes in technology, that we still stay connected to the human aspect in medicine?
Oh yeah. Oh, it's vital, and I think we risk losing it. As we commoditize healthcare more and more and more, as these organizations come into healthcare that really don't have experience in healthcare, they have experience in building business. I think we risk losing that human element. And likewise with AI, I think AI has so much potential to do some amazing things and to really, in many ways, help to standardize and operationalize things that you don't really need humans to be able to do. And that's the exciting part of it. And yet, I think that what my own practice is an example. I tell our residents all the time, the difference between you being a primary care physician and being a family physician is only one thing. It's about relationships. So if you view each interaction you have with a patient as being transactional, as if you're seeing Mick Doctor and I may never see you again, so I'm just going to adjust for medicines, versus I invest myself in that relationship because I know it makes a difference. That right now I'm getting some physical therapy for a health issue, and I specifically chose a certain physical therapy practice because I knew I would see the same physical therapist each time, versus just going in and I'm sure I could see a different physical therapist and they all know what they're doing, but that doesn't mean I would be getting good care. And so that's my fear that's happening as we start to commoditize and treat healthcare more as a transactional enterprise rather than a true profession and a healing profession, that we have the risk of losing that. And I think, when most people kind of will think globally and say, yes, we need to think about healthcare differently and making sure that we have access for everybody and things. But most people choose an individual physician for a reason, because there's a sense of trust and there's a sense that they really care about that individual. And that takes time and investment. That doesn't happen magically in a 15-minute interaction. And so I do worry about that. I worry because I think we have to live in the dynamic tension. It's both. We have to be more responsible in terms of the economics of healthcare. Healthcare is just too darn expensive, and we know that. And there's lots of reasons for that. And many, some that are inside and some that are outside healthcare. And then we still have to make sure that we're taking care of individual humans, because that's when you're distressed, that's what you want. And I think people deserve that. And so that's the dance that we live in right now, Joel. And yeah, I'm as somebody who's been in this space for well over a quarter century, and was really trained and grounded and socialized in the care of the individual, even over the care of the population. I struggle with where I think we're ending up right now in terms of, have we forgotten about the individual patient and we give it lip service, but are we really showing care with the individuals that we're caring for? So it's a tough dance. It's a really tough dance.
Yeah, it's a
and
good.
the money is huge.
Yeah, I think that stewardship in healthcare is so important, and then the doctor-patient relationship cannot be understated. I've seen a patient who, for nothing else besides how good of a relationship they have with their doctor, that's what really helped them get the right outcome and make a behavior change where otherwise it wouldn't have happened. And they credit it to that doctor-patient relationship. So it does have an immeasurable impact on the outcome a patient will have.
Yeah, because it speaks past the mechanics to the human part. And we know often, particularly when you talk about behavior change, much of behavior change is emotional. And you're not going to get to that the first time. So you can teach somebody all the mechanics of changing their behavior, but until you get to that place of why is it that this person is behaving the way they are rather than behaving differently. And that takes an investment of time and trust. And so, without that, you're just going to feel frustrated, and we'll just call that patient non-adherent, and just kind of push them aside and move on. So yes, you're absolutely right that we know that relationship makes a huge difference. We know that in our own lives as well. And yet the business model keeps pushing us in the other direction of becoming more personal in many ways, becoming more mechanized, cheaper, faster, and so how do we not counter that as much as attenuate that and balance that and buffer that so that we don't lose the human element in the process of doing those efficiencies.
It really comes down to, if we want our doctors to be able to take patients to a better place, they have to be in a good place to begin with, and really prioritizing that as a key element in their success.
Absolutely. Yeah, you will never the employee engagement, patient satisfaction surveys. I can never provide 5 out of 5 care if I'm operating as a 2 out of 5 human. It just the math just doesn't work, and people know that. When somebody comes to see me, they know if I'm having a good day or not a good day. And so, I think that you're right. We need to create the space where we can be having good days in order to provide good care, as the two go hand in hand.
It's becoming increasingly clear that in order to effectively manage burnout and overcome these workforce shortages and changes in the healthcare space, that it's really essential for healthcare leadership to have a clear vision and action plan for navigating the challenges ahead, which really means investing in that physician experience, embracing the human aspect of care, right? The art in medicine.
Yeah. Oh, yeah.
What is the first step organizational leaders who are listening to this and really starting to evaluate where their company's at relative to where they want it to be? What's that first step you think they need to take if they want to start making wellness a core part of their overall strategic aim?
Yeah, and I'm not here to promote a product, Joel, but what I would say is if in 2024 your organization is still trying to decide how they want to enter this game of supporting their clinicians and their care teams, they need some outside help in order to do that, because this conversation has been going on over a decade. And that's where I would encourage them to engage with something like the AMA. The AMA will help them do survey work. The AMA will help them to drill down in that survey work and interpret it. And the AMA, through the Joint Medicine Program, will provide an infrastructure for them to be able to, it's a roadmap. And so they don't have to reinvent it. I think often organizations both underestimate where they are in terms of how distressed their staff and their clinicians are. And I think they also often are tempted to try to do it on their own, or read a book and then say, okay, we're going to do this. If you haven't figured out how to build an infrastructure at this point in time, ask for help. There's nothing wrong with that. Organizations all over the country are doing it, and the ones who are both exhibiting wisdom and, guess what, advancing their own organizational cultures in terms of well-being. And so, yeah, I mean, I think that's a question that at this point in time is a pretty easy one to answer. The harder part is for organizations to actually do it. And so, that's about prioritizing. It's easy to give lip service to these things, but it's a lot more challenging when you actually have to put up. And I think that's where, again, these different programs are actually challenging them to say, put up. And it's not that hard, Joel. That's the piece that I hear often for healthcare administrators. It's going to be so expensive, we can't afford it. And if you're actually willing to begin to look at that and engage people in conversation, the cost is not what you think, and particularly for the ROI that you will get from it. So we know you prevent one physician from leaving or retiring early, and the numbers quickly get into the millions of dollars in terms of the impact of that on an organization. And so it's not short-sighted at all to say, let's invest some on the front end, but do so with the involvement of physicians. That's the other mistake I see organizations make all the time. They come up with a program, like they know what's best for physicians or others, and then they just try to put it on them and act on them. And That will never work in any group, but it certainly won't work with a group of healthcare professionals. You get them involved and have ownership, and it will elevate, and it will take on that flywheel effect. And once they start getting into it, because I certainly want to invest in my own well-being. Like, I have a lot of good reasons to do that, both in terms of how I show up as a physician, but also how I show up as a human. And so getting them involved in a structured process is essential. And I see organizations making both those mistakes, not asking for help and not getting physicians involved early in the process.
I couldn't agree more with the AMA being such a great starting point for any organization, right? They have a roadmap to get towards a state where you really are prioritizing organizational well-being. They've highlighted the key pillars it takes to get there. And they have a tiered approach, which is, bronze, silver, and gold level status.
Yep.
So really it's just about assessing where you are currently and getting the ball rolling and building that positive momentum. And to your point, the art of it is really going to be not so much understanding what the pillars are, but really making it personal to the unique circumstances in your organization. That's where it comes down to having that physician-led approach,
Yep.
being so key to the success of any well-being program to prevent burnout.
It's got to be essential. It's got to be essential. Yeah.
Awesome. Well, Dr. Grenwald, thank you so much for joining. This has been an amazing conversation. I think we can't speak enough about burnout, but now is really coming to the time of taking action and really creating healthcare in a way that we can be proud of in the future.
Well, thank you as well. I appreciate all the work you're doing to help advance this whole issue and the care that you have for this problem and for physicians and the care teams. I think is just wonderful. So thank you for all that you're doing.
Thank you so much.
All right. Take care.